Hello, Dr. Chhavi. Good evening. Can we? I think we can start the session, right?
Hello, Shifa. Absolutely. Let's do.
Okay, great, ma'am. So again, welcome everyone to the session. Thank you all so much for joining in. I'm sure if you have attended the session before, you know what the session is all about, right? But to all the newcomers, thank you so much for joining us today. So before we start, I just quickly introduce Dr. Chhavi to all of you. So Dr. Chhavi is our Chief Medical Officer here at Besugarfit. She has more than 27 years of experience as a physician, and she's been treating patients with chronic lifestyle diseases like diabetes, hypertension, cholesterol for the last so many years, right? And she has been training in the US, and she's been also practicing in California, and currently she's in Bangalore, right? And she basically believes in reversing all of these lifestyle diseases to reduce their complications to the heart, kidneys, liver, everything through a non-medical approach, right? And she'll also be sharing with us her 6 steps of daily living, right, which have been a cornerstone for Sugarfit's approach to diabetes reversal as well, right? And if you've been attending the session, you know that in the session that is India Talks with Dr. Chhavi, she will be here to answer any questions you have, clarify all your doubts about diabetes reversal, and also show you a glimpse of the path back from diabetes. And this session, as most of you know, happens every single week, right? On Tuesdays at 6:30 p.m. So even if your questions do not get answered today, you will still benefit from her expertise, and you can join in the next time and also put in your questions earlier on the chat, right? So I think, ma'am, I think we can quickly start. There are so many questions in the chat box and so many people who have been coming or, repeatedly to the session. I think there was also, Rani ma'am, who is saying that she never misses any of your webinars. So I think there are many, many people who come, so many newcomers as well. So thank you so much for joining in. And thank you so much, ma'am, for also taking the time out every single week and, doing the session.
Thank you so much, Shifa, and thank you for the intro. But yes, I am extremely happy that people find it interesting enough to be able to join each time. And I always define, just before I start the question answer session to everyone, that this session, just so that you can utilize it better and to understand what we are really achieving from this session. This session is for everybody to understand diabetes as a disease better, to understand how this disease, as Shifa said, affects various deeper organs of our body, to understand the association of liver, pancreas, muscle, various forms of exercise that help what to do. And it, in general, to guide you to understand how to get off medication, to try and manage or be in control of diabetes, not diabetes to control you. This program is not for individual laboratory discussions. It's not for individual prescriptions, or it's not for individual people wanting for their disease medication prescription or advice. Advice would be there, but it would not be with regarding medications or predictions for you. And the reason being is that some of you, of course, I'm your doctor and you join, and you know very well that I work with all of you in every manner. But people who are not my patients or who are seeing me here, they're here for education. They're here for understanding. They're here also to know that how they can definitely work and be in control and understand how well diabetes can be managed without medication. So let's start. Shifa, I hope everybody understands, and go ahead.
Thank you so much, ma'am. So we have a question by Miss Anju, sorry. So she's saying that her fasting is 140, post-meal it's 280. Should she start medications? She's worried about the side effects of the medications being more dangerous. So in that case, what would be, your suggestion?
So 140 fasting, Shifa, and post-meal 280 actually relates to a glycosylated hemoglobin of above 8%. Okay, and I can't give an exact number, but it sort of correlates with that. And when our glycosylated hemoglobin crosses actually 7.5 or 8, we are starting to affect our target organs, which could be your retina, your eye, your heart, your liver, kidneys, and you're actually paralyzing your metabolism further. My advice to every single person is that if your diabetes has not been a lot of years old, or you're not on insulin or multiple medications, you need to work with a lifestyle um, guide, a person who's your health buddy, or your whatever, somebody who can work with you over a long time to get you into these wonderful habits that will prevent or reverse your diabetes. So I would really want Ms. Shubha to work on a lifestyle program, but because the sugars are so high, if you were my patient, I would first 3 months also reduce the sugar with some medication so that your pancreas start to heal, your liver starts to heal. And once you're into the system of living a particular lifestyle and your sugar numbers are getting much better, take away those medicines from you, because if you're managing it on your own, you don't need medication. But to summarize and answer for you, if a person is to 140 fasting and 280 postprandial, a doctor should put medication on board, because they know that if they don't, the side effect of organ damage from diabetes is much higher than any side effect from that medication. So I hope I've answered your question.
Yeah, thank you, ma'am. So the next question is by Miss Sunita. So she's saying, has noticed with CGM, the sugar spikes for me till 170, 180, typically 30 to 45 minutes after she has like carbs, right? But when I'm off CGM, she typically measures the sugar levels around 90 to 120 minutes with the glucometer. And then the blood sugar is around 120. So her question is whether using glucometer after 90 minutes, is that a correct way to track her blood sugar levels?
Yes. So I tell everybody that you should check sugar levels even at an hour, not only just 90 minutes. If you're really careful and want to get your diabetes reversed faster, the earlier you check, which is not, of course, 30 minutes, but 1 hour, 1.5 hour is better than 2 hours. You are having excellent numbers. It doesn't matter that you have a spike at 30 minutes or 40 minutes. As long as at 90 minutes your spike is coming down to normal, you're doing everything right. So I tell people that if you check your sugar at 1 hour and you are more than 154, you need to work on what kind of food you're eating or a post-meal exercise. If your sugars are at 90 minutes more than 140, you need to work definitely on your sugar levels also. So yes, you're doing very well. You're coming down to 120. And I think whatever you're doing is working. Please don't worry about the 30-minute spike at this point.
Got it, ma'am. Thank you so much. So the next question is by Miss Rajashri. So she's asking if she's saying that if she has diabetes medication, her blood pressure increases, so she has to stop it. So is it something that is normal, or what can be done in this case?
Miss Rashri, I've never 27 years heard that a diabetes medicine gives anybody blood pressure. But we cannot ignore, Shifa, the syndrome called diabetes distress. Diabetes distress is, and I've spoken it on multiple social platforms because I want everybody to start talking about this word and reading about it. Diabetes distress is the stress that the disease causes to people who have the disease. And I can tell you here in this particular case that when you're given a medication, just the subconscious stress that a body feels from taking diabetes medicine can elevate your blood pressure. But I don't know if the drug has a direct role. I have never heard that. I have never seen that. There is no documentation of that. So it's not the drug, something else is happening and you need to talk to your doctor about it.
Got it, ma'am. Thank you so much. Hope that answered your question, ma'am. So we have another question by Mr. Sanjeev Goyal. So he's saying, hello, madam, I have reverse diabetes. HbA1c is 5.4, but doctor has not stopped metformin and sitazip. Is this fair to continue medicine even after blood sugar is normal, both fasting and postprandial?
So let me tell you that Cetapin is metformin. Okay. So there is no difference between the two medications. So you are probably taking Cetapin, which is metformin only. Metformin, as I have told Mr. Sanjeev many times, and first of all, congratulations. I'm very happy you've reversed, and I'm just very proud of you. But think that metformin is actually used for people who don't have diabetes. So I keep repeating that in my India talks that metformin is not only given to diabetes, it is given to young individuals under the age of 20 with obesity, with insulin resistance, or PCOS, many other reasons. So that is very clearly shown in data that metformin helps at the cellular level of making your body sensitive to insulin, so you don't have excess unnecessary insulin lying in your body. It is usually not a very strong anti-hyperglycemic agent. You are very, very free to talk to your doctor and stop your metformin. But if you are any more than 25 BMI, I would suggest to use metformin, because that will help you also to lose some weight, because it make your insulin sensitive. So it's insulin. So saying that metformin is again not in the definition of reversal, because it is not used just for sugar. It is also used for non-diabetic patients or conditions. And I'm sure that if you understand your body weight, your BMI, check up your insulin levels and check your insulin resistance and use it for that, not for diabetes.
Got it, ma'am. Thank you so much. So another question by Mr. Nitin Kumar is that he's asking, what is the effect of thyroid on diabetes? Is there any impact of thyroid conditions on diabetes?
A simple answer would be thyroid when we have, and it's not in control, Shifa. So if a controlled thyroid, like for example, agar aapka TSH, you're taking 50 micrograms of Thyronorm, and your TSH is 3, 4, 5, 6, it's a normal TSH. That means that 50 micrograms has stabilized or balanced your thyroid. In that case, there is no role of thyroid medication, thyroid having any role on effective diabetes. But if your thyroid was not being controlled and your TSH was above 10, the body does feel a slowing of metabolism, and it does have correlation with higher sugar levels. But this is not for people whose TSH is in well control by taking medication. That means your metabolic effect of thyroid here with your TSH being normal is well balanced. So that is not affecting your sugar levels. But if your TSH is above 10, your metabolism can be slow, and that can lead to higher sugar levels.
Got it, ma'am. Thank you so much. So there's another question about water fasting, right? This is by Mr. Omar. So he's asking, is a prolonged water fast recommended to lower your HbA1c?
No. And Mr. Omar, you will not feel good about it, but I have no other way to explain this to you. It's a no. When we take too much water without any solids in our system, remember that our very beneficial electrolytes like sodium and chloride fall in your blood. These are very important for the action potential of muscle working in your body. I have seen many places, people with a water fast having hyponatremia and having major side effects from them. So the answer is no.
Got it, ma'am. So there's actually a kind of similar question about BP, right? Mr. Mohan is saying that his BP lowers to 85 by 50, sometimes. So in that case, what can you do for, in this scenario?
So very good question. And I'm glad somebody's asking me something other than diabetes, Shifa. So I'm glad I welcome any other questions also. This is really good for everybody to get educated. So blood pressure has been very less discussed on this platform. And it is really very, very common in all diabetics. So I think people need more education about blood pressure. As our country, we are really, really not educated about blood pressure at all. So if your blood pressure is getting 86 to 50, sir, this is not good for you, right? So the test which people need to do either is something called an ambulatory BP monitor. It is something that you wear on your arm for 24 hours. It checks your BP every 15 minutes. And it gives a doctor a picture of what happened to your blood pressure throughout the day, with night, sleeping, activity, daytime. And then it tells me how many times in the day you became low, how many times you became high. Is your blood pressure kind of, varying too much? Or should I give a medication in the morning? Should I give the medication in the evening? What should I do as a doctor to somebody who comes to my office, just like you're saying, my blood pressure becomes 86/50. Now, this is concerning because if your blood pressure gets lower than 90/60, then the blood flow to your brain is not enough. So, agar high blood pressure and blood causes bleeding in the brain or hemorrhage, we call it. Low blood pressure causes ischemia or less flow of blood to the brain. Both will cause a different kind of stroke and problem. So what is the ideal BP? An ideal BP is anywhere between 100/70 to 125/85. Just whatever age, just keep that within that range. And if the blood pressure either way crosses the bottom or the top, it's not good for you. So remember, blood pressure, when your blood pressure is 86/50, I do advise people to take black coffee or caffeine in some form because that really pulls it up 5 or 10 points right away. I don't like giving salted drinks because that takes a little time to work. But caffeine really works very, very well for low BP. So my suggestion, if your BP is 86/50, take a cup of black coffee, and I'm sure that your BP will come up. But your BP requires more study. We are all waking up in the scientific world to so many wonderful non-invasive methods of the root cause analysis of chronic disease. So hundreds of tests that are available in the market today, which are non-invasive, they're not blood tests, but they actually look at why a person is got BP or why a person has sugar. I really recommend everybody who is overweight with blood pressure to do a sleep study for 24 hours. That is a monitor that is placed on your finger and some on your chest. The person leaves you with those monitors at night. Next morning, a report comes out which tells me how many times at night you are not breathing and your oxygen levels are falling. When your oxygen level falls at night, your metabolism is highly affected with the oxidative stress, and you will be affected both with BP and a higher sugar level. That's called a sleep apnea study. I would recommend all of you to study what sleep apnea is. So anybody who's overweight. Now, sleep apnea also happens to people who are not overweight. 90% sleep apnea happens to people who are overweight and are not able to close their palate down when they sleep. 10% of people with sleep apnea are also normal weight. I'm sure some of my patients here are also those who I have found out, and today they are without BP medicines. They have found out that if I correct my sleep apnea, BP or my blood pressure also. So blood pressure is a huge syndrome. It equally affects the heart and is as bad as diabetes. And I welcome your questions on that. But this is something that I would like to share.
Thank you, ma'am. So the next question is by Mr. Mahesh, right? So he's asking, can I take alcohol being, a person with diabetes?
आपको मेरा आंसर अच्छा नहीं लगेगा. You will not like my answer. How can I say, yes, you can take alcohol because I know what alcohol does. Alcohol is not good for the metabolic function of your liver. And I need that liver for metabolism of sugar. So I really recommend maximum about 160 ml of wine, and I will recommend 120 ml of hard liquor in a whole week. So, and that also when people are like, we do need something, Dr. Chhavi, we do need something. And I'll say, okay, you know what? This is the max you can take. Stay away from beer, it's malt and all sugar. But alcohol as a drink in any form cannot be good for your diabetes.
Got it, ma'am. Thank you. So this is another question by Miss Veena. So she's asking, what should be the sugar benchmark for remaining medicine-free?
A1C less than 6.5, fasting sugar less than 100.
Got it, ma'am. Thank you. So there's another question by Mr. Nitin, right? So he's asking, how is the diabetic medicine dosage, the timing, how is it important for a person with diabetes?
I don't understand the question, Shifa, but I will just simply answer it that diabetes medication is before either at breakfast or dinner. It should not be taken at lunch. And those are hormonal reasons why diabetes medicines in India is commonly taken after lunch or before lunch. And that is not the right way to do it. It is breakfast and dinner. I don't know what else to answer here. And what does that do? I mean, that's how it's given.
Right. So ma'am, maybe I just have a follow-up question. So what if like a person forgets to take a dose, or maybe it's supposed to be taken before food, but then they forget about it, and maybe they miss a dose. In that case, what can be done?
Take it after food.
Got it, ma'am. Thank you, ma'am. So another question is by Miss Aruna. So she's asking, can we reverse type 1 diabetes?
No. Type 1 diabetes is an autoimmune destruction of your pancreatic beta cells. It usually happens in children under 14 or 12 and requires insulin because there's no insulin that's coming out to digest any tiny carb that you take also. There's a newer kind called type 1 in adult, which is type 1.5, which we are discovering between the ages of 20 and 30, in which there are two kinds. One is an autoimmune called LADA, latent autoimmune diabetes of an adult. A lot of times they come to our program with a diagnosis of type 2 and wrong oral medications. And when we work with them, then we do certain tests for them like C-peptide, islet cell antibodies for pancreas, and we realize that the patient is type 1 and not type 2. And then we educate them on that and we manage them much better. But no, type 1 cannot be reversed. And not type 1 in an adult, which is LADA or MODI. They cannot be reversed.
Got it, ma'am. So another question is by Miss Gunjan. So her HbA1c last month was 12, started medication, but by how much time will it take for the HbA1c to come to an acceptable limit, right? So is there like a specific time duration that we can look to, or what is, dependent on this?
Good question, Shifa, for modulating the question at the end. The thing is that the effort you put in will determine how soon it can happen. I have multiple patients with 12% and going into reversal at 4 months and 6 months, but the effort they put is mammoth. And they're also reducing their medicines simultaneously. So you can do it. 6 months I give you, but you got to put all that effort. There is no magic wand. It is the amount of effort and connectivity that you put in with your coach, the amount of work that you put in. And along when you do put that effort, you realize not only the medicines that were started for 12% to prevent pancreatic damage are also coming down. I have patients at 6 months, hardly any medicine, from 12% down to 5.8. But the effort that they have done is tremendous. So I'm sure you can do it too. Just put that effort in.
Got it, ma'am. So another question by Mr. Ashok. So between fasting and postprandial blood sugar, how much change will be considered acceptable? And he has another question. What is your opinion on HOMA IR test?
Very good. Let's take the HOMA IR first. HOMA IR test is like HOMA. IR is insulin resistance. It's a test where they check your insulin levels and they check your C-peptide, which is the pancreatic beta cell function test. And it's very, very good. It actually gives me lots of information on type 2 diabetes, where a person is, how much work is required, where will the reversal go, will it happen, will it not happen, lot of information. It's a great test to do. I think if I had to do it, that will be the test I'd like to do. And the range that you asked between fasting and PP, let's call it pre and post meal and not fasting. So the range that I would say for fasting, I would like everybody to be under 95. And for postprandials, I'd like everybody under 140. Acceptable range then becomes 80 to 140. For sugar within a 24-hour period. Pre-meal closer to 80, post-meal closer to 140. Yeah, less would be better.
Got it, ma'am. So this is another question by Mr. Sumit, right? So he is asking why the difference in lab result and those in CGM, which can be more?
CGM is a sensor that has a thread-like thing that goes into your arm in the interstitial fluid, but blood mein nahi jata, in the interstitial fluid. So let's be very realistic that blood test that you do or the glucometer you do, glucometer hota hai smaller arteries or ends of arteries called capillary. Capillary blood mein hota hai. Blood test hota hai bigger vein, right? So obviously there will be a difference in all three of them. So the difference between the glucometer and the CGM is about 15%. It is 10 to 15% lower. They are trying to design, newer glucometers and newer sensors that will have less and less difference. But currently, I really like to work like that. And that is why I call the need for sensor or CGM, continuous glucose monitor, as a trend, a learning. It's a test to learn 14 days what I ate, how it affected my sugar, my exercise, how it affected my sugar. For the 14 days, that has told me day and night what my sugars will happen with what I do with my lifestyle. It is not a point number to be focused on. Yeah, let the coach decide on your trend. Let the coach decide on which food affects. You just keep logging in all what you eat and learning. I can't even tell you how much my patients learn from that CGM. But day-to-day management of sugar is done by capillary check, glucometer. Once that 14 days is over, every single person should check and make sure they talk to the coach about what happened yesterday, why is the sugar high now? And there are different kinds of patterns that we check in. We sometimes do fasting, sometimes we do pre and post meal, sometimes multiple times a day, depending on how severe diabetes and medications you are on. So I think I answered the question, Shifa. Yeah.
Thank you, ma'am. So this question is by Dr. Anuradha. So she's asking, I want to know how safe it is to take um, Madhuanshini by Amway instead of metformin. It does lower your blood sugar level nicely.
You'll have to take it on your own accord. Hate to say it, I have no idea of what that's made out of. I'm not a Ayurvedic doctor or a naturopath by any means. I'm an allopathic doctor. So I will let people do what they want. They're all adults. My recommendation will not be for anything but allopathy, or maybe something out of your kitchen like cinnamon and dana methi or karela. That even I eat, so I know that's safe for you. But unknown things or medications out of other parallel medicine fields, I don't get into that. And I don't discourage also, but I would not have knowledge about it.
Got it. So we have another question. Right, this is again by Mr. Sumit. So he's asking, does your HbA1c change with age?
Shifa, I will just stop here for a minute because I'm reading the chats also when I'm talking to you. So I really will request all of you to understand that this program that I do is to educate you about diabetes, your body, your organs. It is not about what is working for you at Besugarfit or what is not working at a CGM level. Or I really will request, because it takes away time and my attention, that you will be helped by your coach. We always help everybody. You will be helped. It might take a little time. Things cannot happen right away. But I really request you not to put chats about what is not working or the sensor is not working or something, which happens to all of us. These are machineries and they take time and they can break down at times. And I can only apologize But this program is about education, and I truly take out this 1 hour to spend time with all of you. And I really want to educate you on the disease and not the operational part or what's not working. My sincere request to all of you to let that be out of this program and work with your coach or your ops person who can help you with it. Shifa, what were you asking? Sorry.
Right. So, ma'am, the question was, does your HbA1c change with age?
Um, should not. The standard is that if you are pre-diabetic, you are between 5.7 to 6.5. And if you're diabetic, you're above 6.5. And that is the rule for all ages.
Got it, ma'am. So, another question is by Mr. Jain, I'm assuming. So, he's asking, are glucose monitoring wrist watches good to monitor your sugar levels?
I don't know which one are we talking about, because there's nothing which is sensitive in the market right now. Apple is trying some new, very, very sensitive, maybe on the wrist glucometers. But up till now, there's nothing that is known to me that is, sort of passed the tests of clinical research and is recommended. So, no, I don't know of any.
Got it, ma'am. So, Mr. Chandramohan is saying that he is 35 years old and he's been diabetic since the last 5 years. Sugar levels are maintained good. Before food is 120 and after food is 184. But his main concern is that his soles are on fire, he says. So, that's his concern. So, what could be the reason for this? So, what would you suggest?
So, burning soles, very important question again, could be affecting the nerves of the feet, which causes burning or numbness or tingling, and it's called neuropathy. Diabetes affects the electrical impulses carrying nerves to our periphery, and these nerves are affected by diabetes and causes diabetic neuropathy. But if people also have blood pressure, Shifa, the burning is a more prominent feature I've seen in people who have diabetes and blood pressure, right? So please get yourself measured for blood pressure, watch your blood pressure, because tingling and numbness is more a feature of diabetic neuropathy. Burning feet is more a feature of BP with diabetes. Right? Both of them can be solved, I promise you. Both of them can be treated. You need to go to your physician. There are medications. Watch your sugar level, watch your BP level, get the levels down, and I promise you that definitely you will see a benefit. There have been millions of patients that I have seen with these problems and have found a solution for them, but a correct diagnosis. So I end up sending most of my patients to get one evaluation done from my podiatrist. Podiatrists are foot doctors who check on your sensation, who check on your neuropathy and the level, and they give me education about what is the circulation level from various. Diabetes also causes circulation issues. So blood circulation of the extremities are affected by sugar levels. You could have cholesterol, blood pressure, all of that affects that, all leading to burning feet or numbness, tingling from diabetes. So there's a lot of evaluation that's needed here, and to really work with it and get you better, it can be done. It has been done multiple times. So don't give up. Go talk to your doctor and get your podiatrist to see you, assess your neuropathy, look at your circulation in the legs, arterial circulation to the feet, and then work with it.
Got it, ma'am. So there's another question by Mr. Kumar. Again, this is a very general question, I would say. And his basic question is, how can you improve the sleep quality?
Good question. Again, I love to talk about sleep, Shifa. So you will see, all of you, when my 6 steps come, that for me, sleep is your healer. As a country, I again feel bad because I compare, and I can't help but comparing, because 14 years or 10 years, close to 12 years, 13 years of my life, I spent practicing in the West. And even when I go back, I do see some. And then I've come in India, and I've realized that we have much, much more sleep issues than the Western counterpart. As a country, we have really lost the rhythm of sleep. You know, when our scriptures and our Vedas, they all talk about sleeping early, waking up early. And I see not children alone, but I see adults. So I know a lot of youngsters in my country whose children, babies, don't sleep till midnight. And we don't realize, and they'll say it very proudly, कि हम कैसे सोएं, बच्चा नहीं सोता है. But I really think that if a child is not going to sleep till midnight at the age of 4, 6, 2, it will have repercussions later in their development. Let us all as a country take sleep very seriously. Let us all get into a habit of discipline to realize what sleep is. If we are going to sleep 2 hours after lunch, why will sleep come to you at night? Who said that we could sleep 2 hours after lunch? We are supposed to take a nap for 30 minutes, rest, lean back, close our eyes. 30 minutes later, we need to get up. We don't need to sleep after lunch. It paralyzes sugar metabolisms. It makes us gain weight. It is terrible for night sleep. So the first principle of achieving good sleep is get your cycle right. Don't sleep in the day, sleep at night. Number 2, people who eat late cannot get sleep. So there's another thinking that I am as a doctor fighting for the entire country. हमारा पेट भरा हुआ है, we can sleep well. Rubbish. Full stomach causes acidity. Full stomach causes hormonal changes. Full stomach causes growth hormone not to work and for your body not to work properly. So having a really light stomach at sleep is the best way to sleep. So what does that mean? Eat 3 hours before bedtime. Get off these screens, the TVs, the serials that you see at late. Make sure you see them in the daytime. But after 7 p.m., after dinner as a family, sit together, play board games, read a book, listen to music. There are many things that you can do. Walk a little bit after dinner, and I promise you that sleep improves. Breathing, meditation, very, very important to spend 5 to 10 minutes even in the evening before sleep. If you cannot sleep, take a nice bath before going to bed. Make sure your bedroom is cool. A hot bedroom without proper cooling does not let us sleep very well. So temperature control of your bedroom is very, very important. And then, of course, probably writing a journal of, I always tell, gratefulness before sleeping is a very good way of sort of just letting all things that did not work out for you in the day go out of you, and writing a journal and being grateful for all those things that happened in the day that get you go through your day with success should be documented and revived when you go to bed. And after we have done this, very rarely that I feel that people cannot sleep. It is a lot that we have done to our daily life and our discipline, which has caused so much sleep issues in India. So I think let's look at it as a country. Let us understand how simple these practices are and how we need to slow down and slowly wrap up and attach with family rather than putting TV and all of us watching TV after dinner time. That will be good for our soul and for our sleep.
Thank you so much. I think those tips would be really helpful for everyone. Right. So, okay, this is by Mr. Mohit. So he's asking, can diabetic medications cause weight loss and thyroid issues? He has lost about 10 kgs while being on medicine, and his thyroid, reading, it dropped to 0.015.
Oh, let me tell you why your thyroid readings dropped. So number one, we'll go on the thyroid. So when we have gained weight, sir, the fat also collects between our thyroid. The weight gain, the fat, causes the thyroid not to work well. And as a result of it, the TSH can be slightly higher. Right? Now, in your case, I'm a little concerned because the TSH has gone down. You have not written if you're taking thyroid medicine or not. But when I see a person whose weight loss has happened 10 kgs and their TSH has gone down, I want them to be evaluated for a syndrome called hyperthyroidism, which is the primary problem of the thyroid gland, which is overactive thyroid gland, and that could make you lose weight along with it. Now, coming to the diabetes medicine, when there are certain groups of diabetes medicine, so diabetes medicines usually are classified in 3 groups: those that increase weight, those that keep the weight normal, neutral, and those that can help you lose weight. So yes, there are certain, I don't know which medicines you take. There is a group, very small group though, of diabetes medicine that also might form in SGLT2, which causes you to lose weight. But here, this is something that needs to be really evaluated. If someone's TS is just falling and they don't take thyroid medicines and their weight is going down, you immediately need to be evaluated for something called hyperthyroidism, which is a syndrome of the thyroid gland and not of diabetes medicine.
Got it, ma'am. Thank you so much. Right. So actually, ma'am, there is another question, right? Again by Mr. Lokesh. So I'm sure, we'll touch upon this in the 6 steps as well. And I think you go on this over and over again. But he's asking, is everyday sugar measurement necessary?
It is a discipline, Mr. Lokesh. Do you want to be daily accountable and manage your sugars, or you want to be accountable twice a week, or you want to be accountable once a week? Your recovery, your management, your reversal will depend upon your dedication to your accountability of your sugar. If you're asking me, yes, every single day is a must, because I want you to be accountable every day of how you need to live that day after what happened or what you lived yesterday, right? So I will leave it up to you, but if somebody asks me, that is the answer I give. Check it daily when you're fasting and be happy the whole day, knowing where you need to control your eating, where you need to control your exercise, and work on it right away. So it's very important that all diabetics know that people who check daily, multiple studies have shown over past 50 years, the people who check daily are people who can reverse their diabetes really well. Okay, and people who are not able to check them daily, their management suffers because they are not able to be accountable to their sugars every day. So yes, people who check daily are accountable daily and are very good in reversing diabetes. People who check twice a week will have their results accordingly, and people who check once a week will have their results accordingly. Always there is a fallback and growth of diabetes when people check less frequently.
Got it, ma'am. So there is another question, right? They're asking, how dangerous is it to have diabetes and fatty liver together at the same time?
I don't know so I don't know them as patients. I don't know how bad their diabetes is. I don't know how grade 1, 2, 3. So for everybody's education, fatty liver is basically fat collection between the liver cells, which if it increases too much, starts to destroy your cells, and you get this destruction of the cells of the liver causes the liver tissue to become harder or fibrosed, and ultimately leads into a condition called cirrhosis, which is liver failure. So fatty liver can be at grade 1, grade 2, grade 3, and then cirrhosis, right? And then there are tests. Ultrasound tells you about fat in the liver, but does not tell you about the fibrosis or destruction of cells. For that, there is a test called fibroscan. I usually, for grade 1 and 2, do not do the fibroscan, Shifa, but if it's a grade 3, I definitely send them right away for a fibroscan to see how much fibrous tissue has collected and cirrhosis. So I don't know where you are. If you're grade 1 and if your diabetes is average, you are reversible, your fatty liver is reversible, weight loss. If you're grade 2, your diabetes is moderate, you need more work, but again, a lot can be done for you, and at least you can bring back your fatty liver to grade 1, which is not that bad. If you're grade 3 and your diabetes is really, really bad, you need help.
All right, ma'am. Thank you. So I think we'll just take a couple more questions before we move on to the 6 steps, right? So this question is by, I'm so sorry, just a minute, ma'am.
No problem, my dear.
Okay. Right. So, all right. So there are a lot of questions. So I'll just, take a couple of them, right? So this is by Mr. Urmit, right? So he's, been having diabetes since 2021. After that, he took medications for 1.5 years, and in Jan of this year, he stopped taking it, and instead he started Ayurvedic medicines. And after that, he lost around 20 kilos, but his sugar remained the same. Almost, the fasting is around 115, post meal is 200, right? So he is asking, is it normal or is he doing something wrong?
Definitely something is not right about what you're doing, sir. And something is resistant and something is not working out. So I think we need a complete evaluation, blood test, C-peptide, beta cells of pancreas work, HOMA-IR. We need to really look at what's going on in your metabolic picture. Where's the fatty liver going? What is your muscle percentage of the body? How much of the visceral fat has come down? How is your metabolism? There's so much to see and understand before we create a personalized plan for you, Mr. Weber. Good luck. I mean, I'm glad that your fasting is 115, but I'm not happy about the 200 after meal is very high. Weight loss will always help you, but provided that you have made more muscle and lost fat and not just lost the weight, because you need to create building muscle now, because that's very important. You need to do HOMA-IR, C-peptide, and then we can probably look at it and see where you're going.
Got it. So I think we'll take one last question and then we'll move on. So this question is by Mr. Anil, right? So he's asking, while his fasting is 101, postprandial 136, but his HbA1c is 6.4. So he's asking, why is it so? And I think the other thing I want to also ask is, like, is fasting and PP the only thing that you need to consider, when you're looking into HbA1c?
What did you say was the fasting? Sorry, sweetie.
101, ma'am.
And the post meal was 136.
Yes.
And he's 6.4.
Yes.
That's what it is. I mean, you can't have an exact 6.5. You're actually exactly at 6.5. Now, the lab can be 0.1 errors. So 6.4 and 6.5 is no difference for me. So you're perfectly matching exactly what it should be. So I don't know what I need to answer, because it is matching and he's saying it's not matching.
Yes.
No, it's matching. It is completely matching. So human bodies don't run at a 0.1% precision. We are humans. The lab tests are also done in certain conditions. So 101 is close to 100 and 136 is close to 140. And then you are close to a 6.5. If you go to 95, that is controversial. And if you go to below 95 fasting sugar, and if you go to less than 130 post meal, I promise you, you'll get lower in your A1C, which is what you're looking for, probably 6%. And that has to be every day, not once in a while. And I think that's when you will hit a difference. But right now, it's matching, so I don't know how to mismatch this.
Got it. Thank you so much. I think a lot of people have that, doubt about the matching. The sugar levels are somewhat normal, but HbA1c is still not normal. Kind of situation.
Shiva, let me explain to that. So I see people, like, for everybody's knowledge, they'll say that their fasting is 140, their postprandials are 200, but their A1C was 6.5%. That cannot be, right? Because you guys have to understand that there were 100 times in the day that your fasting could have been 80, or pre-meal could have been 80, and your post-meal could have been 100. You might be hypoglycemic. A1C is an average of your sugars for 3 months. So if you are 140 and 200 when you are checking, but there are certain times in the day you are 80 or 70, and you are even lower as hypoglycemia, which you have never checked, which you haven't felt because your body doesn't feel hypoglycemia, the average A1C will be lower. Now let's take another scenario, like our last member. And if your fasting, he says, is 101 and postprandial is 136, suppose the A1C came 8%. Patient will say, what is this? I will say this is because there were times in the day and you are having too much glycemic variation, which means the top and the bottom number are too far from each other. Instead of us being in the range of 80 to 140 in the day, we are 70 and 2, maybe whatever, 110, and that is why 200. And that is why when you are checking, you are getting 70 by, or whatever, 100 by 136. And the times you're not checking, and that is the average of A1C, now it's 8%. So the mismatch is that, And I answer and explain, and so do the doctors and the coaches. So I think people just need to understand that one check of fasting and one check of PP does not determine A1C. A1C is the average of all your sugars over 3 months in your body.
Got it, ma'am. Thank you so much, ma'am, for answering all the questions. I think now we can move on to the 6th step. So I'll just quickly share my screen.
So I know all of you, again, I say that, see me and see the 6 steps, and they're very, very important to me and very dear to my heart, because for years and years and years that I have worked as a doctor, I have always wished that my patients and my diabetic patients would adapt to these 6 habits in their lives. So I made them big and I show them every time, because if you guys can take these 6 things within you and live that life, a lot in your life will get better. A lot in your life will be fixed. So keep charts, I tell, keep markers and say, I've mastered the 1st step and I mastered the 2nd step, I've mastered the 3rd step, and come and tell on the program when you join how many steps each of you have, who join regularly, have mastered. I will feel absolutely fabulous if you were to give a feedback and say, this is what I do, how I work on Dr. Chhavi's 6 steps, and how my goal is to do them tomorrow if today I have not been able to master them. And there is nobody gauging you. You are gauging your own self. So let's start with the 1st step. And that's always, as I said, checking yourself daily, being accountable for your sugars daily, and making sure that working on the same day that the sugar went up rather than waiting 5 to 10 days before you check it. The second is eating salads before your meals. So remember that a bowl of salad before each meal, not lunch, not only dinner, each meal, anytime you're going to have a main meal, if you put a bowl of salad in your stomach, you're lining your stomach with salad. And that does not let the sugar levels spike after food, because the food does not get absorbed very fast when your stomach is lined by fiber. Salads could be very healthy in different types, very simple, like just cucumber and carrot or tomato or onion, or very dramatic with whatever you want to do. There are all kinds of salad recipes on our app and on the internet. And please make sure you put in raw vegetable in your system before you try and eat your main meal. Third, sleep 7 to 8 hours of uninterrupted sleep, which does not mean कि आप रात को 2 बजे सो सकते हैं और सुबह 9 बजे तक सो सकते हैं. That's not what I'm talking about. I'm talking about sleeping on time, which means 10 to 11 in the night and 6 to 7 in the morning waking up times. Making sure that you're using the advantage of the good hormones that come out when you're in deep sleep in these times and help you digest and increase your metabolism. So sleeping is the 3rd step. 4th step, circadian rhythm. Every cell in our body has a biological clock that responds to sunlight and darkness. You are awake and active and blood circulations when the sunlight is there. Your hormone cycle of the body, what hormones need for regenerating the body that come out in the night. Don't let your insulins work. So people who eat late in the night, kuch nahi ho raha. That food is just collecting in your belly because the insulins and your digestive hormones don't work once it's dark. So my recommendation to everybody on the program is try this. 7:30, eat before 7:30 until morning 7:30, just water. Live on water for 12 hours, eat for 12 hours. Let the body get cleaned. Let the hormones that regenerate your body work on your body. And I promise you will feel lighter, stronger, fabulous. So all of you, 12 hours of eating, 12 hours of water. Very important. Step 5, some kind of exercise. I always hear men say, I walk every day. Good, but not enough. If you did not learn strength and conditioning of your body, you do not learn muscle building, if you do not learn how to flatten your abdomen, if you did not hear how to do abs, if you yoga is good, stretch is good. So mixture of aerobic that uses oxygen for your body while you exercise, and anaerobic which uses glucose, which are the muscle buildings and strength and conditioning. They use glucose for energy in your body while you exercise. So do a mixture of aerobic and anaerobic, and that's ideal for you. Step 6, which is my favorite, a bit of dhyan, meditation, a bit of mindfulness every day. Meditation is not breathing. Meditation is not pranayama. Meditation is silence. Meditation is watching those thoughts come in you and letting them go and not getting involved with those thoughts. Meditation is about the more sharper we get, the more deeper we get, the more silence we get into. And as time goes by, this meditation helps us develop mindfulness. Mindfulness is the presence, my presence with you right now, the presence in that minute, so your productivity is 200% in any form. The food you eat, if you're 100% aware of the fiber, protein, and carb content of your food, and you work on your food in that manner, that will work on your body much better. How do I exercise mindfully? If I'm waiting for a doctor in the waiting room, how I mindfully be peaceful and not agitated? In any situation, anger and stress will not come if you meditate and the mindfulness comes into picture. So these are my 6 steps, and they really, really work. And I pray that all of you will work towards developing it and come and tell us how they have worked for you.
Thank you so much, ma'am, for sharing your 6 steps and also for answering all the questions so patiently. And to all the participants who joined in and asked such amazing questions, thank you all as well. So, like Dr. Chhavi said, we would love to know, which of the 6 steps you're following, if you, started any of them. So we'll definitely, looking forward to seeing you next session so we can hear more from you. So as you all know, next session will be next Tuesday. So do join in. It'll be a Hindi session, right? Same time, 6:30 to 7:30. We're looking forward to seeing all of you there and hearing from you, if you've incorporated any of these, practices in your, day-to-day routine. So thank you so much, ma'am.
Shifa, I already read in the comments, and I'm grateful for all your comments. And I'm reading people who are saying we will strictly follow them. I promise you'll see results, and it makes me extremely happy. They're very simple. That is what we always have been destined to live life like this, especially in our culture, in our country. We really believe in all of this, but we've left it all behind. So there are so many practices that follow this, Shifa, and we've just left it somewhere without realizing. So I want everybody to come right back and not need medication and not need to feel out of control or powerless with diabetes. I want you to feel powerful. I want you to know that we are all with you, and God bless. All of us will work well for you. Have a good evening, everyone. Shifa, thank you very much.
Yeah, thank you so much, ma'am. Have a great evening.
Bye-bye.
Yeah, thank you so much, everyone, for joining in. You all can drop off the session now. But if you want a personal consult with a health coach, you can definitely leave your contact details in the chat and we'll reach out to you